Hi everybody, this is Melissa and I want to give you a tutorial on what to expect with vertical gastric sleeve surgery. What do you expect after having the vertical gastric sleeve surgery? Well, right after surgery, what you're going to expect is you're going to be in a lot of pain. For the first 24 to 48 hours, or even maybe even longer, you are in a tremendous amount of pain, but it is tolerable. Personally, it was the worst pain I ever felt. I'd had a hysterectomy before, an open hysterectomy where they cut you wide open, and this was much worse, to be honest. Just so you can be prepared on what you're gonna feel. Would I do this again? Of course, 100%, 150, 2000%. What how I am today compared to what I was before surgery is just a tremendous change. I feel like a totally new person. But your pain control, that's what the first 24 hours, that's really what it's all about. Making it through the first 24 hours and keeping your pain under control. You will have what's called a PCA pump. It's got like a button on it. You push it. You can push it usually like every 8 to 10 minutes. And you get a specific amount of drugs, pain medication. You can't overdose yourself because it's a setup. There's only so much you can have per hour. So you don't have to worry about, getting too much. It'll only give you the med when it's available to be given. If your pain is totally out of control, like mine was, that first, say 3 or 4 hours, I was in a lot of pain. They were able to give me something that what people would call breakthrough medication. They give you something a little extra through the IV. Sometimes it's not even considered a pain med. It's called an adjunct med, which increases the effectiveness of the pain med. The two meds together work together to make you feel less pain. Sometimes they give you something like Phanergan, which is actually for nausea, but makes you sleepy, so you don't realize how much pain you're in. I did have somebody with me when I went for surgery, a family member that went to the hospital with me because you are in pain. You're unaware, sometimes the pain meds make you real groggy and you might be falling asleep, but you're still in a lot of pain. And this person can be there for you to help you make wise decisions, just to be there for you in case something's going wrong and you're not with it enough to know that there's something going on or going wrong. So I think it's very important to have a spokesperson. It's also very important to have an advance directive before you go in for surgery. Have somebody that's you designate to make your healthcare decisions while you're in the hospital. When you get home, what can you expect? How much pain can you expect to be in? Well, you are painful, but at that point, by the time you get home, usually 2 to 3 days after you've had surgery, the pain is tolerable. Usually they'll give you like Vicodin or I just came home with Tylenol 3s because I had like some reaction to the Vicodin, so I decided to come home with Tylenol 3s. I wouldn't advise coming home with just Tylenol 3s because I was in quite a bit of pain because Tylenol 3s is kind of wimpy as far as I'm concerned. So I think they can give you Percocet, or Vicodins. Usually that's like liquid. The Percocet's a tablet. The Vicodin is liquid, and the Vicodin was real like alcohol-y, and I think that's what made me really sick. You don't have much on your stomach, and that kind of ugh. So, anyways, I was very sick with that. Some advice about taking your medication would be to take it what we call around the clock. So, like if you can take it every 6 hours, just take it every 6 hours for the first few days till you realize how much pain you're in. Because if you wait and let your pain get out of control, it's really hard to get it back in check. How do you feel once you get home? Well, you're not going to feel great the first few days. You know, you really just want to take it easy. Don't have to do too much around the house or anything like that. You know, basically getting up and going to the bathroom and maybe getting yourself what you need to eat, which that first week is just liquids, is enough. You need to not overdo it because you will feel it. After the first week, you're going to start noticing some improvement. Having left-sided abdominal pain is to be expected for about 6 weeks, and that's where your pain's going to be. The rest of my, from my surgery, the rest of it, it wasn't that painful. Just that left side, when I would bend over, something like that on that left side, it just really was painful. And that, my surgeon told me that's expected for the first 6 to 8 weeks. So let's talk some more about the left-sided abdominal pain. What does the left-sided abdominal pain hurt so much? Well, there's a pretty easy explanation of why it hurts so bad. When they do your surgery, that's where all the instruments go through, and that's where they pull out your stomach. So it's the muscles and the fascia and all that stuff that's in there gets stretched out farther than the rest of the incisions, and so that is going to be really painful. Anyways, that's about all I got to say about, having some great information right after having gastric sleeve surgery. And if you want some more information on gastric sleeve surgery, you can visit my site at www.verticalgastricsleeveblog.com. Thanks a lot. My name's Melissa, and have a great day.